Welcome to the SIBO Doctor podcast with Dr. Nicola Jacoby, a US-trained naturopathic physician and medical director of the SIBO Doctor, an online education resource for practitioners. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. Medical experts join us to discuss functional digestive disorders, clinical practice and research as it relates to SIBO and associated conditions. Head over to thesibodoctor.com where you can learn everything about SIBO from the basics to advanced treatments. You can also join in the conversation on the SIBO Doctor Practitioner Forum Facebook group. If you're a patient, please note this information is not intended to diagnose or treat medical conditions. Please ask your doctor before initiating any new treatments. We welcome you to head over to the SIBO Lifestyle Facebook group, where we post frequent tips and videos to help you on the road to gut health recovery. And now, over to Dr. Jacoby and the SIBO Doctor podcast.
Welcome, SIBO practitioners, to another episode of the SIBO Doctor podcast. And my guest today is my friend and colleague, Dr. Nicola Dehlinger, who is a naturopathic physician practicing in Durango, Colorado. And she has a real specific focus on mind-body medicine and has also a summit that she's putting together on anxiety, which we'll touch on in our conversation today. But she's going to be one speaker of a number of speakers that I want to bring on the podcast to talk about the effects of stress on the body, as well as trauma and different ways we can address this in our patients. So welcome, Nicola.
Thank you so much. I'm really excited to be here.
Really excited to have you on the podcast. We've been sort of dancing around for a while to have you on the podcast now, haven't we?
And here we are.
Yes. And how's it going with your summit?
Oh, it's really exciting. Yeah, I was telling you before, I love interviewing people and getting even more information around all the different avenues that lead into anxiety, because that's what this summit's going to be focused on. It's really so multifactorial, and so many different pieces of physiology and spirituality and emotions are all playing in. And so it's really nice to get such a broad perspective from so many amazing naturopathic doctors.
That's great. Your specialty is mind-body medicine, and you talk a lot about that also in your Facebook groups, and when we've had conversation as to how you do that in your practice. But let's start with, because stress and anxiety has such a huge impact on our physicality, especially our digestive tract. And that's one of the reasons I want to spend a little time on what actually happens with not just acute stress, but chronic stress, particularly on the digestive tract. So can you just start that conversation and kind of walk us through some of the physiology?
Sure. Yeah. I think what happens first and foremost is that when we have an increase in the sympathetic nervous system because of any stressor, and it could be a small little one or a big one, emotional or physical, there's a bunch of things that happen in our body when we move from the parasympathetic into the sympathetic nervous system. So basically we're preparing to fight or to flee, right? So we want to kind of move all of our resources to the periphery and to the amygdala part of our brain that can help us scan and be hypervigilant. And so when we do that, we're shunting blood and resources and nervous system tone away from our internal organs, from our endocrine system, these kind of longer term things, because it doesn't really matter if you're digesting your food if you've been eaten by the saber-toothed tiger. So that's how our system is set up. So we have an increase in blood pressure, increase in heart rate, increase of oxygenation and blood flow to the limbs, and we actually have a shutting down in our central organs. And so, for example, we can see, we'll have a bowel movement, and because that sphincter opens, because again, you don't want to have to stop to go to the bathroom while you're trying to flee an enemy, and then it'll tighten back up again. And then that's what we see a lot when we have diarrhea and constipation, either alternating, or it can move into a chronic constipation where people have a really hard time moving their bowels. And partially that's because they're having a hard time with the innervation and the motility in their gut. And so that has a long-term effect on these functions because it was meant to be a short-term response. But when we have these stressors day after day, hour after hour, year after year, it starts to really mess with that vagus nerve and that feedback to the brain where we're always in that high alert. And so we don't have proper blood flow to our central organs, and it messes up our endocrine system as well.
So, and we've, in previous podcasts, of course, I've touched on chronic stress before, and it's such a prevalent epidemic, really, in our society, especially with the state of the world. It seems like we can't really escape being faced with pretty traumatic experiences almost, just in world politics nowadays and what's happening to our environment. So even though, if you're listening and you don't necessarily have a stressful job or stressful family life, you are still not immune to the effects of more global stress and trauma. So,
Yes.
And one of the things that really happens, and I want to reiterate that Dr. Dehlinger just mentioned, is the fight or flight response. So the two arms or branches of the nervous system, of the autonomic nervous system, just to kind of go back to basics, are the parasympathetic, which is rest and digest, and the sympathetic, which is fight or flight. So those are always in balance. And when you have a sort of predominant fight or flight, this is exactly what we're talking about. There's brain changes, there are physical changes that just 5 minutes of meditation isn't going to be enough to address necessarily. It's better than nothing, but it's still going to need more of a management that's beyond just that. Would you say?
Absolutely. Absolutely. And there's actually that third branch of the autonomic nervous system, the vagus nerve, which has so much to do with the brain-gut axis, It modulates inflammation. It maintains intestinal homeostasis. It regulates food intake and satiety. It has a huge impact on psychiatric disorders, which is kind of this gut-brain connection that we hear about all the time now. And it's really, a lot of that is mediated through the vagus nerve. And what we're seeing is that people are having atony of that vagus nerve, or just lack of stimulation. And so it is really an important piece to remember that there's actually this third arm that can cause a lot of these issues, and that nerve is actually bidirectional. And what I mean by that is that there's information coming from the organs up into the brain, but there's also brain information coming down into the organ systems themselves. And so when someone presents with, let's say, a GI disturbance and anxiety, the GI disturbance could cause the anxiety, or the anxiety could cause the GI disturbance. It can go either way. So I think what I see a lot of times, especially in folks that tend to specialize, is that, let's say there's a gut specialist or digestive health specialist, they'll tend to focus really on the pathophysiology in the gut and really minimize the impact that the brain, and I actually don't think it's just the brain. I think this is the spirit as well, like a kind of our mental well-being has that reverse impact on the gut system as well. So we have to really the underlying cause. We really can't we can't blow off the role of the mind-body connection.
I never actually heard the vagus nerve referred to as the third branch of the autonomic nervous system. I thought it was part of the parasympathetic. It's mainly parasympathetic in nature.
And that's kind of how I had read about it previously. But what I've been reading about more recently, like there's an article from 2018 that I'm referencing, and they're talking about these three distinct branches. And so the vagus does a lot of that parasympathetic type activity that we think of, but they're actually saying that it's a different piece of that system.
Interesting. Yeah, the vagus nerve, everybody just, we've heard so much about it, and the effects of stress and chronic stress and tension. Some people can't really relate to the word stress because they're so in it all the time that they don't really think they're stressed anymore. It's more of a level of demand on you that is relentless, I would say. It's like constantly you have to do something, or something is in your mind without real adequate periods of rest, in a way.
Yeah.
So,
the phrase I use with my patients, and then when I'm teaching this stuff as well, is I kind of want to take away that word stress. It's kind of like wellness. It's kind of ubiquitous and now has lost any real meaning. But I talk about resiliency. And so it's not so much, are you stressed? Because I'm pretty sure most of us would say, yeah, sure, but no more than usual, or no more than my neighbor. But it's really that question of overwhelm is what I'm seeing with stress. And if I ask people if they feel overwhelmed, most people are going to say, yes, that's a regular experience that they have. So they can connect into that. So I would offer that to practitioners as a key word to use when interviewing patients, rather than stress, because it's kind of lost any meaning. And then if they don't know what I mean by resiliency, I'll say, if you kind of have a rubber band and it feels like there's just no more stretch in the rubber band. And so when we talk about some of the therapeutics, especially the mindfulness-based stuff, I talk about that offering some more stretch in the rubber band so that when the next thing comes on, they do have some flexibility rather than this really taut rubber band, and that's going to lead them to snapping.
What's always interesting also to me is that even though I'm a SIBO specialist and you are a mind-body specialist, we see the same level of physical issues, So
yeah, absolutely. Well, yeah, and that's just it. I mean, and there's a primary care research article that came out about 10 years ago, and what they were saying is, and they looked at the correlation, and this is just in a primary care office. This is not in a digestive health or gastroenterologist office, and they were interviewing anyone that had any type of GI symptoms, and they did a screen for depression and anxiety. And they found out that anyone who came in with just even one digestive symptom had a 5-time more likelihood of having depression and 4 times more likely to come up positive for anxiety. And so it's really, these things come hand in hand, and they're constantly influencing each other up and down that vagus nerve.
Well, and just again to reiterate, when we are in a state of overwhelm, I would say, or stress or fight or flight, then not just blood flow is diverted from your digestive tract to the periphery, but also your digestion essentially stops, more or less.
Yes.
And so if you can imagine the impact of that when you are maybe 50% of your waking hours in that state. So it's an often under-addressed, I think, issue in office visits is to really help your patients to not just manage it, but to really understand what's happening so that they can change, make those lifestyle changes. And sometimes they have to be dramatic. They have,
Yes.
and to the point where they may have to get out of a toxic relationship, or they may have to change their jobs. And I'm not one to tell people you have to quit your job, but it's about facilitating a conversation where they might make that conclusion that it's just not worth it to have that level of physical stress on their body. How often does that happen, Nicola, with you?
Quite a bit. Because I'll ask the question, it seems like we're coming back to this same thing. Let's say in this case, your job, do you think you can heal or do you think you can take care of yourself the way you need to while you remain in this position, or while you remain in this relationship, or, what's really the obstacle to cure? And so, like you said, it's pretty tricky territory to tell someone they need to make a major life change, but really curious, open-ended questions can be incredibly helpful at eliciting what seems like the writing on the wall from the practitioner point of view. And that person either doesn't see it yet or isn't really ready to accept that as what needs to happen. So this is part of our role with the mind-body counseling that we've all been trained in, is to really help people slow down enough to listen to what their body's been telling them. And I guarantee you, if you listen and just reflect back what they're saying, they'll think you're brilliant. But really what's happened is that you listened and parroted back what they've just said because they already know what they need more often than not.
It's definitely a sort of a tricky territory, I find, because very often as a practitioner, I can see that a patient is really overwhelmed with something. And then it's sort of my job to figure out if by obviously improving their digestive function, will they get out of that state of anxiety and overwhelm and become a little bit more resilient, or is it the other way around? And that sometimes takes some time to figure out. But because I have plenty of people that say, well, I used to be really overwhelmed and now I don't feel as overwhelmed because I just feel better in my body. So it's this interesting perception that we can also have when we're ill, that I usually, what I usually ask people is like, do you startle when a door gets slammed? Do you easily startle? And for me, that often means that their nervous system is just really, has been really overwhelmed, is if people startle easily. The startle reflex. So if you live a pretty relaxed lifestyle, you probably won't startle as easily. Is my point to that.
Right.
So
it makes a lot of sense. And I mean, as you already know, I mean, if we're going to talk about SIBO specifically, I mean, the cause of SIBO is a question of much debate. But I think that there isn't just this one linear thing. Oh, you had this exposure to a parasite, or you had a really, stressful thing. But really, this idea of stress and anxiety and worry plays a huge role in the people that are coming up positive for SIBO. And so I think if you've done your more physiologically based protocols or treatment for what you're doing, SIBO or anything else, and people aren't getting the results that you would have expected from a really well thought out treatment plan, then I think it's a great avenue to say, we've done a lot of these antimicrobials and we've done the diet and we've done these pieces. And I would just hope that you would be feeling, I'm glad that you're feeling 50% better, but what I want for you is optimal health. Do you think that this chronic stress, you keep on mentioning your relationship with your husband, or you keep on, mentioning that you don't get enough sleep? Like, do you think that these pieces are playing a role, and then start to bring them into the conversation? Because I think a lot of people, when they initially at least come to a naturopathic doctor, they're kind of expecting that same allopathic model, just with herbs instead of a pharmaceutical. Like, you're going to give me something that's going to make this go away, rather than this is going to be more of an internal process in addition to the nutraceuticals we can add on.
Yeah, and I definitely want to, in the second part of this podcast, go to some of the techniques that are not just out there. There's so much available now that people can utilize to help change some of these autonomic nervous system dysfunction states, whether that's trauma work or even the dynamic neural retraining system. And there's just so much amazing things or programs out there that can really help people. But I specifically want to ask you, just even for some suggestions for practitioners of how they can incorporate this a little bit more into their practice, also of just simple techniques that they can offer their patients. But one of just to kind of dovetail on what you said before, it was an interesting study that Dr. Pimentel mentions a lot. And Dr. Pimentel is a SIBO researcher that many of us are very familiar with his work. And he often cites a study that was done in the Gulf War, during the Gulf War, where soldiers were assessed for the development of IBS after they came home, and they looked at, really traumatic exposures like, killing a person and shooting the gun and all of that. And those parameters were not as definitive as having had a case of food poisoning in the development of SIBO, which is just so mind-blowing to me, because we've always associated IBS with stress. That was what people were always told. It's all in it's in your head, and you got to relax more, and then your IBS will go away. So we definitely have a situation, especially with SIBO, where that affiliation or association isn't as clear, even though
Yes.
we know historically and also clinically that there is a big factor, and especially if you consider that chronic stress can really affect the migrating motor complex, which of course is the motility cleansing wave that sweeps through the small intestine and really keeps SIBO at bay. So we do have that as well. But I just wanted to mention that there are sometimes overriding factors to the development of SIBO that are sometimes, we'd think that something like having really traumatic stress will cause SIBO, but we don't
Sure.
really have evidence. But I do think it prolongs it, and it contributes to it not resolving. I definitely see that in my practice.
Well, and I think that, and this is where it gets all interwoven as opposed to one empirical data source or starting point, is that, there's evidence coming out now about the microbiome and the bacteria, and whether or not that microbiome is healthy and diverse actually has an impact on the vagus nerve.
Mm-hmm.
And so here we go again, like with this whole thing. It's not just the PTSD of having had to kill someone in service, impacting the gut. It's actually the gut, moving in the other direction.
Mm. Yeah, and just some of this most fascinating research, epigenetic research, and also childhood trauma causing an altered microbiome. One
Yes.
can't help to think that we have this little microcosm inside of us that is very responsive to what happens to the rest of us. And until a few years ago, naturopathic doctors have known about the microbiome for a long time, but the gut and the microbiome is just like the catchword of the last few years. And
Decade. Mm-hmm.
yeah, so the whole thing is really super fascinating. So let's kind of, did you want to say more about trauma or childhood trauma and gut issues?
Yeah, I would like to just touch base on it briefly. I think a lot of people have heard of the ACEs studies now, and ACE stands for Adverse Childhood Experiences. And basically what they're referring to is whether or not they had some sort of abuse in their history, living with someone with mental illness, their parents separated or got divorced, domestic violence, alcohol or drug abuse in the home, either physical or emotional neglect. So these are some of the things that we consider childhood traumas. And so what they did is the first study, and there's been a lot more studies since this one, the first one came out actually in 1998. So this information is over 20 years old, and we're just now starting to see it actually maybe getting integrated in primary care, which is exciting. But the first study had an N of 18,000 people. That's
Whoa.
a lot of people in the study. And only 1/3 of them reported no negative events. There was about a quarter had one negative event, and 41% had 2 or more negative events. And so the more events you've had in your history, the higher the likelihood that you're going to actually develop chronic disease, be that digestive issues, cardiac issues, diabetes, addiction, on and on and on we go. What's interesting of note as well is that over 2/3 of women who answered actually had reported at least one event. So if we go back to this kind of, 26% had one event, 2/3 of those are women. So we have to really think about that. But I also wonder, this is just kind of more of a musing. I don't have any research to back it up. If men don't necessarily identify things that were hard in their childhood as traumatic events. And so it's really important to know how to screen men and ask questions that maybe are more direct than open-ended when we're trying to figure out if there's any of this history in the background. And so what we found is that there's neurological changes that happen with folks with ACEs in their background. There is neurobiology, so we'll see a dysregulated HPA axis. We see a shrinking of the hippocampus, which is the part of the brain which helps us think and remember and learn, those sort of things. We see what we call a hypersensitized amygdala. So again, the amygdala is that reptilian part of the brain that is really where that fight or flight response is coming from. But what happens is that part of the brain actually gets bigger over time. What's nice now is we didn't know this before. We used to think that once brain changes happen, they were stuck forever. But now we know that there is neuroplasticity. And even if there's a oversized amygdala and small hippocampus, that by using these mindfulness techniques primarily, we can actually reverse that pattern and restore normal brain function and size. But I think I just think it's an important thing to note that even if someone has pretty easy living now, like they love their job, they love their family, they're exactly living where they want to live, finances aren't a problem, like, it's just kind of smooth sailing. If you meet that person, let me know. I'd love to chat with them about how they got there. But, even if that's the case, if there is some childhood trauma that has been unresolved or undealt with, not dealt with quite yet, then that is going to have an actual physiological impact. And so from this gentleman named Felitti, who actually was the first one to come up with one of these ACE studies, I want to just read this quote because I just think it sums it up beautifully. And he says that the traumatic events of the earliest years of infancy and childhood are not lost, but like a child's footprints in wet cement are often preserved lifelong. Time does not heal the wounds that occur in those earliest years. Time conceals them. They are not lost. They are embodied. And so I really feel like that sums up what we really need to help people do as the cutting edge of primary care is really help our patients realize how much of an impact that this is potentially having on autoimmunity, on inflammation, on psychiatric issues, on gut function, et cetera, et cetera, et cetera. Because as we all know, when the sympathetic nervous system is activated, we have higher levels of cortisol, which is our primary stress hormone. When we have higher levels of cortisol opposes insulin because we don't want to put blood sugar away when we think we're going to need that glucose to fuel our limbs to escape or fight. Cortisol also has two primary roles in the body. One is to manage inflammation and the other is to manage the stress response. So if a lot of cortisol is being diverted down this stress pathway, then we don't have nearly as much for a healthy immune response and a healthy inflammatory response. And so this is where we see this autoimmune chronic inflammatory component coming in from chronic stress. We are so far beyond thinking that wellness or mindfulness is a nice option if only I had the time. And for anyone who is listening, especially practitioners, if you are not practicing this yourself, you are going to have a very difficult time convincing your patients that it's worth it. And sometimes I will start my sessions, especially if somebody comes in hot, they're running late or they're really upset about what had happened or they're not feeling good. We'll just start the session by taking 3 deep belly breaths together and let them land, give them a sacred space in your office where they can just slow down. This is one of the advantages that we have of longer visits. There's plenty of time to tell your story. You're sitting with someone who genuinely cares and wants to listen. I see 6 or 8 people in a day, not 40 or 50. So we have this really unique gift of developing our relationships with our patients. And that in and of itself, if you can, by controlling your own breath and monitoring your own nervous system, know how to calm yourself, you can actually entrain with the patient who's sitting with you, and just your presence, you shifting your own electromagnetic vibration by getting into a more calm state has a positive impact on the person sitting across from you. So these are things that you can do whether or not you want to be, you're worried about being seen as woo-woo or out there or you want to be very medical about your approach. You can still be doing these things internally, which not only benefit you personally and your own physiology, but they've actually been shown to increase patient care, patient outcomes through things like empathy and that sort of thing.
That is very well said. I think that I love your passion about this because it's so infectious, really.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.